Welcome back to Premom Health India. Today we are opening the conversation on a quiet yet widespread challenge affecting urban households in India. What many experts are calling silent ovulation crisis. Nearly 1 in 5 women in India live with PCOS, and millions more deal with demanding working hours, sleep deprivation, and high stress every day. Many assume that as long as they are getting a monthly period, their body is ovulating normally. But elevated stress hormones, irregular meal timings, and disrupted circadian rhythms can silently delay or even suppress ovulation. To help us understand the link between stress, biological clocks, PCOS, and natural conception, we are talking to a renowned fertility expert, Dr. Sreevani, today. Dr. Sreevani is an integrative OB-GYN and PCOS fertility specialist with 10 plus years of experience. She helps women struggling with PCOS-related infertility conceive naturally as a first line of treatment. She recommends naturally using food, exercise, and sleep as medicine and supplements. She has helped more than 1,000 women conceive naturally without the need of IUI or IVF. A very warm welcome to the Premom podcast, Doctor.
Thank you, Judith. I'm so glad and excited to discuss on this topic today. Yeah, so 90% of women I work with are working women, and I see their challenges and struggles very closely. And yeah, so definitely stress and lifestyle disturbances play a major role. They may be ignoring them, but they impact their hormonal balance very badly. We actually have a connection between our brain and ovaries in the form of hypothalamo-pituitary ovarian axis, actually. So this modern lifestyle, which is leading to stress, is disrupting that axis, and it is causing disturbance in the hormonal rhythms, eventually leading to infertility issues.
Yeah, that's true. Nowadays, the lifestyle is affecting everything in the body. So let's start with the most important question, the first question. Why do so many people miss their fertile window despite having regular periods?
Yeah, so regular periods always does not mean that ovulation is happening, okay, or egg is releasing. So we can divide women into two categories here, non-PCOS and PCOS women, because anovulatory cycles are commonly seen in PCOS women. So in non-PCOS women, usually ovulation happens 14 days before their period. So usually 21 to 35 days is considered a normal menstrual cycle. So for some, it may be 28 days, for some, it may be 32 days. So on an average, 28 days is common. So usually ovulation happens on 14th day. But if their cycle is different, they should calculate it as 14 days before their period. So usually women track their ovulation using some regular calendar apps, right? So they usually take 28 days as a standard menstrual cycle. So if their period cycle is different, okay, 30 or 35 days, so they may miss that fertile window. Usually we take 5 days before ovulation. Okay, from 5 days before ovulation to ovulation day is the fertile window. So if they blindly trust the calendar app, they may miss the fertile window. So using ovulation strips simultaneously along with the calendar app will help, actually. So when coming to non-PCOS women, in PCOS women, ovulation may not happen on time. Some may have regular periods and still ovulation may not be happening. And commonly, many will be having delayed periods. And so the periods can delay for months and sometimes for years also. We call it amenorrhea in severe cases. So in such cases, definitely they need to work on regulating their periods. And definitely these calendar apps may not be working for them. Unfortunately, doctors are giving the birth control pills, right, 21-day pills to regulate their cycles artificially. So that is what I don't recommend. And I treat them naturally to regulate their cycles. and then ovulate naturally so they can conceive naturally. So just blindly following calendar apps, they may miss their fertile window.
Just because they are having regular cycles doesn't mean that they are ovulating normally or everything in the cycle is normal, right? The
Right.
periods are not the only criteria on which we can decide that, okay, ovulation is happening properly. Okay, so doctor, nowadays PCOS is a very growing concern in India. Most of our viewers want to know that how is ovulation different for women with PCOS and how is it different for a woman who is not having PCOS?
In non-PCOS women, normally ovulation happens if their hormones are balanced. In PCOS, what happens? The ovulation is slightly delayed, or sometimes it is absent. Okay, depending on the severity of the PCOS. Why this happens is because there is a small defect in the ovaries. So it's a genetic defect. Okay, very minor genetic defect, not a major one. Because of that, estrogen levels will be slightly low in women with PCOS compared to non-PCOS women. Then the signals to the brain are disturbed. Okay, so our brain, the hypothalamus and pituitary gland, it starts secreting FSH and LH hormones in abnormally high levels because it is sensing that estrogen levels are low in the blood. So it produces more follicles in the ovaries. And even LH, the estrogen levels are not so much that it will trigger the LH peak in a proper way. So ovulation will not happen properly. Dominant follicle is not formed properly and ovulation is not happening. So that is the main difference between non-PCOS women and PCOS women. And like PCOS is not a recent one. Okay, it's not a recently seen condition. It is there for 50,000 years. Even our ancestors had PCOS. The genetic problem is there. But they did not have any symptoms like how we are having. So they were also having the hormonal imbalance of slightly low estrogen and slightly high testosterone levels. But the level of imbalance is very minor in them. It is more in modern women. And because of very high levels of testosterone and very low levels of estrogen, that is affecting all our organ systems, because estrogen receptors are present throughout our body, not just in the ovaries, uterus, vagina, and breast. So our gut health gets disturbed if our estrogen levels are low. Our brain circadian rhythm gets disturbed. Right? All our organs like liver, pancreas, all organs function suboptimally when we have low estrogen levels. Even immune system gets affected. So our body will be under kind of stress. It is a kind of chronic stress because all organs are functioning suboptimally. They wanted to function at their best, but they are not able to do that because of slightly low estrogen levels. So PCOS is a chronic inflammatory condition. So because of high inflammation and insulin resistance, it is affecting ovulation. Okay, the egg quality is getting affected. Ovarian function also depends on the insulin hormonal balance. If we have more insulin resistance, ovaries become resistant to the hormones.
Okay, talking about this, let's talk about that. You already mentioned that environmental factors are also affecting. So, how are these night and day shifts, or irregular sleep, or diet, lack of physical activity, and everything, all of this, how is it exactly disrupting the ovulation, the process of ovulation?
PCOS is the most common endocrine disorder in women nowadays, and it is the most common reason for infertility in women nowadays. Right? So it is all because of the, of course, unhealthy lifestyle. And coming to diet, so many are like neglecting their food. They're in a hurry for their work, and they are not taking care of their food, sleep. They're not, basically, working women are not having time for themselves. That is a main issue, main thing I'm seeing. But they need to prioritize it, actually. So skipping of breakfast is the number one mistake, most common mistake they are doing. They either skip the breakfast altogether, or they take very light breakfast, just nuts and seeds, and they'll finish it. So that is a biggest mistake, because our body is most insulin sensitive in the morning hours. So whatever we eat in the morning, we will be able to metabolize it more efficiently in the morning than in the night. So they don't eat breakfast, and they binge eat for lunch or dinner. So because they don't eat breakfast, they will be feeling very low in energy by the time they reach the lunchtime. Then insulin ups and downs takes place actually. So the sugars, so if they eat in the morning, insulin balance will be good, sugar balance will be good. So ups and downs will not happen. They don't feel cravings for other foods like sugars and carbs. Okay, so mainly they should eat well for breakfast, and in the dinners they should eat very light dinner and early dinner. Because they are not eating breakfast, they tend to eat heavy dinners, heavy and late dinners. So what happens in the night, our insulin should be very low. Melatonin levels should start rising after sunset, and cortisol levels also should be low. So when we eat in the night, insulin levels will spike. So when insulin spikes, again, that leads to storage of the fat. It increases insulin resistance, and that leads to resistance in the ovaries. So ovulation gets affected. Okay, so that's the main thing behind. So that's an important big mistake they are making in their diet. So they have to eat a nice big breakfast, protein-rich breakfast, and dinner should be light and early. Even if they eat late, our gut has a clock. Okay, so if we eat late, so that clock gets disturbed. Our gut thinks that that is a daytime, and it starts producing insulin and other digestive hormones. So that disturbs the clock, and it also disturbs the menstrual, hormonal rhythms.
Mainly the breakfast plays a very major role in our lifestyle or in our diet, because the insulin works better in the morning, and if we have a good healthy breakfast in the morning, insulin levels will work as they are supposed to work, compared to
Yes.
how we Indians are having the dinner, a very heavy and full packed dinner, and then insulin is not working properly and everything gets disrupted because of that.
Yeah, they need not actually reduce the overall calories also. Just swapping the dinner items to breakfast would be a good change. I mean, if they make this change, that would help them a lot.
Yeah, so right now we are having lighter breakfast and heavy dinner. So it should be swapped with a heavy breakfast and
Yes.
a lighter dinner. Okay, our lifestyles and daily habits, as you have already mentioned, that they play a major role in our reproductive health. So, what are can you just give a list of what kind of habits or nutritional adjustments or lifestyle changes that a woman can make in her body or in her daily life that can help her try to conceive? Can you, something practical or a list of things that can be done?
So you can do, coming to diet, as I have already mentioned, you have to prioritize your breakfast. Your breakfast should be protein rich, and you have to actually include more of the plant-based protein than animal protein. You can include about 80% of plant-based foods and 20% of animal-based foods actually. Then you have to avoid snacking in between meals. Okay, so usually we tend to eat some snack mid-morning and again in between lunch and dinner, right? So actually you should have three nice big meals. Okay, I mean big breakfast, moderate lunch, and small dinner, and try to avoid snacking in between meals, because this will give rest to our gut. So it's not always about eating, but giving rest also heals your gut. So in the night also you have to give about 12 hours of fasting window. Okay, break 12 to 14 hours of fasting. Even fasting for long hours is not good for PCOS. You should not fast for more than 14 hours on daily basis regularly. weekly once, if you want to have a long fast, you can have, but on daily basis, you should fast for 12 to 14 hours in the night. So have big breakfast, moderate lunch, and small dinner. Avoid snacking in between meals. Include more of plant-based protein in the form of beans like moong, chana, rajma, chole, tofu. Soy products are also good for PCOS. Also, walking, physical activity, right? So most of the women, working women, don't find time for workouts. They cannot spend 1 hour's time for workout, right? So at least if they spend about 30 minutes every day, splitting into 10 minutes post every meal, post breakfast, if they do walking for 10 minutes, 10 to 15 minutes, then after lunch for 10 minutes, and after dinner for 10 minutes, if they, at least if they do this, that will bring a big difference in their insulin hormonal balance. They can also, if they cannot even walk, they can do heel raises also. Okay, this is about exercises. And about sleep, they should try to expose to sunlight. They should avoid screens in the night. And they should, so just sleeping for 7 to 8 hours is not enough. Sleeping at right time and for right amount of time is important. Like they should go to bed before, they should fall asleep before 11 p.m. They should not cross 11 p.m. That also disturbs the hormonal balance actually. So if in case if it is they're not able to do it, they can take the help of melatonin supplement.
Okay, so doctor, lastly, I want to ask that how can ovulation testing and hormone tracking help a women, especially those who are having PCOS? How can this help in conceiving, or they have a better chance of conceiving if they are using ovulation testing or hormone tracking?
Yeah. So first, they should regularize their periods actually. So if they want to use the ovulation tracking kit, they should have regular periods, right? So if their periods are very unpredictable, so they need to keep on using it. They never know when it ends actually. So first they need to regulate their periods. Like calendar apps or alone is not enough. And ovulation strips is also may not be enough, especially in women with PCOS. LH hormones is imbalanced. LH levels can be high in the beginning of the period itself, so it may mislead ovulation. So, so if we combine couple of things, then accuracy will be good, along with calendar app. So your Premom app is also there, so it is good. They can use that. Along with that, ovulation strips, you are providing that, right? So along with ovulation strips, if they also take help of basal body temperature tracking and cervical mucus observation, if they combine all these three, then the accuracy will be more.
Thank you so much, doctor, for breaking down such a complex topic in such easy words. What stands out today is that irregular cycles of PCOS are not a dead end. They are simple signals for our body asking for balance, routine, and the right tracking tools. That's what Dr. Sreevani also mentioned, that combining good lifestyle with ovulation tracking and using everything in the right proportion will definitely help you with PCOS or deal with PCOS. At Premom, our goal is to empower every woman to understand her unique cycle without fear or guesswork. Whether you are managing PCOS, navigating a busy work life, or planning for your future family, knowing your fertile window is the best first step. If this episode brought you clarity, please subscribe to our Premom Health India. Drop your questions for Dr. Sreevani in the comments below and share this video with someone who will benefit from it. Until next time, stay informed, track smart, and take charge of your health. Thank you for tuning in.
Thank you so much, Judith.